Okay, so that's just to warm you up and give you a bit of an idea of what's actually going on out there in society. And look at the changes, 2.7 billion in 2006, and now, you know, there's over 31 billion questions being asked in Google. And what does that mean for us in healthcare? Those patients that are walking through the door, or those who've not thought about it, but just wondering, what was that bit of advice that that doctor or nurse gave, or health professional gave, or healthcare assistant, or whatever? How are we going to compete with that? How are we going to support patients with that? How are we going to deliver good quality care where patients trust us? Which takes me to this page. This is my consulting room, and hopefully you can see an expert there. Who's the expert?
The patient.
Ah, the patient, someone's. Oh, both. Let's start with both. Who's both?
Yeah. Well, actually, if you count the inanimate object, then there's more experts behind that.
So how many experts can you see there?
Can I see?
Mm-hmm.
Well, I can see 2 human experts, and the inanimate object contains faceless experts behind it.
Like? What's the animal? Which one are we talking
Oh,
about?
the computer.
The computer. Okay. Let's go with each one. Someone said patients. We've got some patients in the audience. Let's ask them. Why are patients experts?
You're experts in your own limited way about yourself personally, or at least you consider yourself to be.
Absolutely.
You know as much about you as you are able to do, and
So
then
what
ask
sorts of things-
questions beyond.
What sorts of things do you know about that these two don't?
Probably all sorts of personal things that would be so emotional or even abstract that it would be extremely difficult to pass on to doctors, but in the end you look to their expertise to sort of whittle through it all and give
Okay.
you the answers you want.
Let me give it out. Imagine this patient actually has turned up with back pain, and she's had back pain for a few weeks, and she's been up all night because she hasn't been able to sleep all night. And actually they're thinking about going up into the Lake District and having a 2-week holiday hiking. And what she's actually more bothered about is the fact that should I book that really expensive holiday in that really nice hotel in the summer so that I can go up there? Or the fact that her husband's been up all night because she couldn't sleep and she was screaming in pain and things. And you can suddenly start to see that the patient is an expert in terms of the symptoms of whatever it is they're presenting with, and how it's affecting them, and also how it may affect them in the future and some of the decision making that they have. So that's the patient. Is this guy an expert? The doctor. Why is the doctor an expert?
I'd like to think he knows a little bit about the conditions you're complaining of.
Absolutely. So something about the conditions. Is there anything else that he's got expertise in?
That's all guiding her through the health system as such, if she needs to.
Good. So let's just expand on that a little bit. I'd like to think that I'm a fairly safe pair of hands. I'd like to think I know a little bit about back pain and things. Would I be a good doctor here if I suddenly decided to open, not that I'm about to, but if I suddenly open shop here, would I be a good doctor?
Do you mean compared to the ones we've already got?
Yes. Yes. Absolutely.
Just ask the doctors to come on while we're on.
It's going to be a riot now, isn't it? Get rid of it now. If I wouldn't, I mean the implications I wouldn't, why wouldn't I be a good doctor if I suddenly tried to start shop here and now today?
You wouldn't necessarily know what to signpost or where to
Bingo.
signpost.
Absolutely. The thing that the clinician has expertise of is, yes, they might know a little bit about back pain and diabetes and things, but what they don't know about is the specialist diabetic nurse, the podiatrist, the local hospital, in a world of choose and book, which department is good, which isn't, where this particular patient ought to go, or whatever. So there's expertise that that clinician has, and I say clinician in the broadest sense, around not just the condition, but also something about the services that are available and whatnot. So there's that. Now, you mentioned there's a third one, the inanimate object. Why would a computer be an expert?
The computer is just a methodology to reach other experts, and that can be through papers and other sources of information, reliable or otherwise, that sit behind it.
Okay, so there's a source of information towards papers. Is that it? Is there anything else? Is there any other expertise that the computer provides? Back to the doctors in the room.
When you've got pathways, you can sort of access things like map of medicine for current
Right.
evidence-based guidance.
So it provides us with knowledge to help us understand how we can manage things. Actually, that might feel quite alien to most doctors in this country. GPs as well. What do most GPs use the computer for?
Entry consultation.
Yeah, absolutely. When that patient comes in and you type in the name of the patient, up comes a summary of the patient's condition, what medications they're on, allergies they might have, what tests they've had, previous consultations, a reminder for the doctor that, you know, this is where we're up to with the patient. So there is expertise that helps the clinician to help that patient. What about in the opposite direction? Is there any expertise that computer gives to the patient?
Isn't that possibly a problem at times? You know, I don't know, not being a doctor, but could you imagine a patient coming in and saying, well, I've seen such and such on the internet, and they nod as if the internet's the god, so why aren't you doing this to me? I've heard people saying that. Sort
Yeah.
of thing.
And you may have also heard other people say that, but by the grace of God, actually Google helped me to work out what my diagnosis was. So it does work both ways. So there is something about the computer helping the patient, or perhaps not. And actually the same is true for the computer sending the doctor in the wrong direction, because the previous doctor had gone completely wrong in the wrong direction, and we just ended up following it. So it does work both ways. But yes, you're right, that the computer could help the patient. One proviso, of course, is as long as that computer is giving them good quality information and pointing them in the right direction. As long as you're getting good quality information, then that could end up becoming an expert to support the patient as well. Okay, so let's go further. If the patient comes to me and expects me to provide them with good quality information, and actually that patient trusts me to provide the best information that that patient needs, and conversely, if that patient gives me good quality information about what's going on, and you know, let's put hidden agendas aside for a moment, but just assume that the patient is trusting the doctor and telling them everything that they can about the symptoms and what their worries and concerns are and what ideas they might have, and we start to build a partnership of trust between us, then something very, very exciting happens. Especially if we then use that computer to support the two other experts. And it's that support that the computer provides to the basic conversation that's going on between the clinician and the patient, where sparks begin to fly and something really, really exciting starts to happen. And I call that the partnership of trust. And the issue there is, why should I trust that computer? Why should the patient trust the computer? And how does it help with the relationship that the clinician and the patient has? That's the most fundamental thing about it. If there's nothing else you take away from today's meeting, then please remember, patient access to records is not about the computer, it's actually about that relationship between the clinician and the patient. And if you remember that, and then start thinking about how this might support it, bingo, you've got something really, really exciting that you can then start moving forwards to, and then you become less worried about that patient trying to sue you about something, and you start getting very excited about patients that actually are using similar knowledge to yourself to try and work through things and try and work forwards. Okay.